So soft tissue dermal fillers, we offer a range of dermal fillers here, both the hyaluronic acid variety, which are the common dermal fillers that we know most people have had long practice with now.
Looking at where filler can help is probably around here and those cheeks, and in that area we're starting to notice the volume loss, and we're trying to sort of get that definition back in the jaw.
And as well as the biostimulant fillers, which are more into reversing the ageing process from a sort of a deeper level and improving the collagen in the skin. So it's great to be able to offer those treatments in combination, because I think they work well together and produce results that are very natural in the long run. We don't aim to want anyone walking out of here looking like they've had too much filler in their face, and it's important to realise that we can address concerns where fat pad loss is occurring on the face, getting ahead of the game really. So most of our aesthetic treatments are used in combination, so there's pretty much not many patients who don't have an indication for a dermal filler after the age of 35 onwards. It's using subtle amounts in areas where you can see where the ageing process is going to occur and preventing it from happening. But often the average age of patients who present to us have already experienced quite a significant volume loss in their face, and they're noticing that ageing hollowness that they get after the age of about 40. So in that sort of patient, there's an indication for dermal filler over and above anything else probably.